I wanted to give you a broader picture of what happened in Israel in 2024 as it goes to West Nile. You all know this, even the things that we do know about West Nile. We know that this is coming from birds through mosquitoes to humans. And we are sort of an incidental host within it. And we know that most of the people who get infected are asymptomatic. So even what I'm going to show you about the diagnosis, it's the tip of the iceberg. There are a lot of other people who probably went undiagnosed. So this is what we saw. We saw an unprecedented surge of morbidity in Israel. You see all the years before, and it was a huge increase in numbers, all in like 2 months. The summary of the outbreak looks like that we have nearly 1,000 cases, confirmed cases. And again, these are people with symptomatic infections. So just imagine how many people were infected and were asymptomatic. And we had over 600 of them hospitalized and 74 mortality. So the CFR is 7.8%. This is how the outbreak timeline looked like. It started very early in the end of May, the beginning of June. We actually heard it from Ichilov Hospital through the media, I should say, saying that there is an explosion of cases, 3 cases, which is a lot in the ICU at one time at the beginning of a season. And then we were trying to figure out what is the difference this year compared to others. And as Gili said, this was a peak. And we were thinking, oh my God, this season is going to be horrible with thousands of cases. And it wasn't the case because we realized what the problem was. And I'll show it with them in a moment. But the exceptional disease pattern was in several folds. First of all, it was the case volume, a lot of cases at the same time. The timing of it, which is started really early. Usually the peak, as you probably all know, is September. This was June. And the wave width, usually it comes slower. There was a huge increase that came all together. And all of that was completely different. The distribution of the age group was not really different than what we see usually. You're seeing here confirmed cases per 100,000 and deaths. So usually it's on the higher end of the scale, which is what we saw here. We didn't know if we will see a different clinical picture, younger people get infected, younger people dying, but no, it was usually the usual clinical picture that we are seeing. The geographic distribution was really interesting. This is a clue to the reason at the end of all this huge outbreak. As you can see, I'm not sure you are all reading Hebrew, but for those who are not reading Hebrew, you're seeing a huge increase at the beginning in May in Tel Aviv. So there was one spot where it all started, and then it moved to other places. And when we were trying to figure out what's different this year, because this surge of cases is really very unusual, to say the least. So internationally, we looked around, there was nothing. If we're thinking about climate change as the driver for this, climate change happens everywhere in the world, right? We're a hotspot, but there should be some increase somewhere else as well. There was nothing elsewhere. We looked at the birds, and this is information from the Rashut HaTeva VeHaganim and the Ministry of Agriculture, and the numbers or the rate of disease in birds was uniquely different than usually, both in birds that are wild birds, but also in birds that are part of Hayot Mahmad, pets, which is totally unusual. People don't have West Nile in their pets, in their bird pets. So something was very different in that case as well. And then the mosquito surveillance that is done between the Ministry of Environmental Protection and our entomology lab, and then the virology lab of the Ministry of Health virology lab. So all of that thing was also very uniquely different, with a lot of traps being posted, a lot of mosquito collected. And if we look just at the numbers of those cases compared to 2023, just to show, there was a huge increase in infected mosquitoes and in populated areas. This is from WNV lab to show that what we see in the laboratory testing in the virology lab, you see a higher increase in the load, in the PCR load in the blood, and that was also something that was not seen before. And this is again from WNV and Neta. The virus was not different. So we were trying to figure out what's wrong. We actually went, or I should say WNV and his team went to the Biology Institute and trying to inject it to mice and try to figure out, is it more violent? What's going on? Nothing. It is the same virus. It's not more violent than usually. So I'll start with saying what the response was from our perspective. First of all, we needed public awareness. We need to work within ministries, as you'll see in a minute. We need to have a database response. So we need to have a database. We needed to see where the cases were, and we needed to respond to them. And the regional focus in order to make sure that we have efforts in the right place to eliminate mosquitoes. There is a different word for that.
Eradicate.
Well, I think there's a different word for that, but never mind. So with the public awareness, that was a problem. We had kind of different messages between the Ministry of Health and the Ministry of Environmental Protection. They have this slogan saying, all kinds of slogans saying you need to eradicate mosquitoes only at the end if nothing else fails and all of that. And we were saying, no, people are dying and people are with encephalitis. We need to eradicate mosquitoes now. So there was some problem with that, but we did webinars also for medical teams, webinars for local authorities to increase awareness of what's happening and what they can do about it. And a lot of work went into that. The second thing was, or it was kind of concurrent, was interministerial coordination. We needed to figure out what was happening with the birds, which is information that the Ministry of Agriculture holds. We needed to figure out what was happening with eradication attempts at the local authority, which the Ministry of Environmental Protection holds that information, and also what is happening with human cases, which is the Ministry of Health. And we were on a daily basis. We were working together in order to see all the picture and putting layers of data, as you see on maps, between the birds, the mosquitoes, and humans. And here is how you see that we were following this data very, very, very closely in order to make sure that we give the right guidelines or the right orders to the right local authorities to do their eradication attempts. And then the response was directed in the places where we saw that there was a problem. At some point during this, looking at maps, and this is something that Oscar, who is the lead on the entomological lab in Jerusalem, realized that there was an overlap between the places where there is mosquitoes and the places where we have a water treatment facility that was failing. And basically that was the reason for this whole thing. Matash Ramat Sharon, a water facility, a water treatment facility that is located in a very strategic place next to Tel Aviv, next to the Yarkon, moving the water with the mosquitoes into Tel Aviv, where people are walking So that was the main problem. Obviously, afterwards it became bigger than that, but that was the reason for this beginning. And for us, this is a signal that we need to do something different. And I want to end by this slide, which is one thing is to actually do all the work that is being done here. And this conference is really exciting, seeing how we can actually take some problem and fix it or find a solution. What we are also trying is to see how we can prevent it. And vaccines are a great way of prevention, but another thing is to make sure that we realize or monitor this in time, because when we look back, we see that birds were starting to fall, drop dead in the streets of Tel Aviv at the beginning of June, but there was no connection between those dropping birds and the Ministry of Agriculture and the Ministry of Health in order to see, oh, there's something different. Maybe we should do something about it. So the thing is to make sure that, first of all, we look at all the components. Yes, climate change is going to be a huge factor, and probably we need to do things about that. But we have to make sure on the second point here that we need to manage our sewage better and make sure that we are monitoring all those places where we have sewage facilities, because the population is getting bigger and probably we have more and more failures of those facilities, and we need to monitor them because they're a source of infection. And then we need to look at how we are monitoring the whole situation on kind of on time, in real time, and not getting to a point where a physician in Ichilov is raising a flag saying there are 3 people in the ICU with West Nile. We should have been able to see there are more mosquitoes. They're in Tel Aviv. There are birds dropping dead. So we should have been able to monitor all the pre-human things before it gets to human. And then the last part, which is a very challenging one, is the deficiencies in pest control readiness. I think this surge showed us that we're not as good as we think about pest control. And this will have to change because West Nile is just one example. There could be other pathogens worse, and still the pest control is not that good. And the coordination between the Ministry of Health and the Ministry of Environmental Protection is challenging, and the coordination of them with local authorities is challenging. So we need to figure out how we learn from this outbreak in order to make sure we put in place a better infrastructure to monitor, identify, and then put in place actions in order to control. And this is outside of the health system, where we will develop vaccines and we'll do a lot of things, good things, but there are a lot of things we need to do with other partners outside the health system in order to prevent this whole thing. Thank you. Yes.
How local was this? Was there a knock-on regional effect? No, in Egypt, Jordan, West Bank. What happened there?
It didn't go outside of Israel. It did go from Tel Aviv, Herzliya, Magan, the central area. It went to other places. And we can follow this, and we saw how it spreads from place to place, but it didn't go outside. And we were looking closely at Egypt, Jordan. We were actually talking to them to see if there was something that they're seeing before we realized that this is the water facility treatment management that caused the whole thing. But it didn't go outside.
Do we
But
know
in Israel,
that? Do they document? Would we know if there was an outbreak in Egypt? They would document that?
I don't know if they would document it, but we talked to them directly. So we actually made a connection both with Jordan and with Egypt to learn if they have more cases. So maybe they wouldn't put it online. I'm not sure how transparent they are with their data, but we were actually talking to them directly to see if they're seeing anything, and there was nothing.
And just one more question. The fact that it was a water sewage treatment facility disaster responsible this time, it could be something else next time.
Right.
Yeah.
Right. And I think the challenging thing is it's not something that the Ministry of Health is managing on its own. So there are things that we can say, we're following we can do it. No, there is this whole One Health approach where you need to look at the animals, you need to look at the environment, and you need to look at human. It's very, very challenging to see how we coordinate all three ministries in order to work together on real time, have the data, respond correctly.
A comment, usually we are looking for sentinels, looking to the birds to see whether there's a high mortality, looking to the mosquitoes, but we don't look to human beings.
Mhm.
And we know the vast majority are humans who are asymptomatic. So my question or my suggestion is why not to take few sentinel labs and toward the season of the West Nile to check them, people giving blood samples for blood count, etc. We can do a pooling like we have done in the Corona time, and then maybe we can get the signal, which is much more important among humans.
So that's a great idea, and we're working on this. One of the things that I didn't share, but Yaniv can tell in length about it, is that blood samples donations are being tested for West Nile at the beginning of the season, and usually the results are not even getting to us in timely manner. So if it's positive, they throw it away and then they report at some point. But if we use it as a signal, it's something that could be extremely helpful. So there's a lot of things that we are trying to think differently about that. One of them is the blood donation. Another thing is something the Ministry of Agriculture is building, which is monitoring wild animals or wild birds in this case. So we're learning a lot from here, saying we need a different infrastructure, whether it's monitoring differently human beings and animals and mosquitoes, and also putting the traps differently, because usually previous years the traps were put in rural areas, like in the wild, whereas here the problem was in the city. So you need to figure out how you also monitor and put traps for mosquitoes in cities, not just in the reserves. So a lot of learning from this thing. Yeah.
And I ask you, Sharon, if it was considered in the framework of the One Health and the good collaboration with the other ministries, or trying to increase the collaboration. Is there any idea about interfering with the mosquito population like they did in Brazil with the dengue problem? And now I heard in Argentina they're trying to introduce this population of mosquitoes which are sterile.
Yeah, so so there was one interesting initiative by Modin, that they introduced without speaking to anyone, not us, but not the Ministry of Environmental Protection or anyone else. They introduced mosquitoes, sterile mosquitoes. The thing is, it was not the right type of mosquito, so it wasn't really helpful. But we realized from that thing that there's no regulation about introducing mosquitoes, sterols, genetically engineered or whatever. There is no regulation. So this is something that we are working with the Ministry of Environmental Protection to put in place, because that's one of the really useful tools, but you need to define how you use it.
I'm completely opposed to what Elishvat said, because taking human as sentinels is exposing many people to very severe disease until you can catch the problem. Because even if you would have done plasma assays and you would catch it 1 week earlier, it took about 1.5 months or 2 months of many people with severe neurological outcome. And I was in the meeting where the person controlling the mosquitoes, the sentinels, told us how many traps they put, and they didn't find any problem. So there is a problem with people that should do their work, and humans are not good sentinels.
So I think what
It's only human, but not in a disease where you have. I reported to the Tel Aviv municipality 1 week before we started hearing about the dead crow on the way to the beach. And a week later, I was on call and I had 10 encephalitis cases. It makes no sense.
So this is why I said, I think we need to look at it and use as many tools as possible. I think looking at donation of blood is a very simple tool. We have it. We actually test for it. We're just not getting the results in time in order to inform us. But it's okay. It's not the only thing. I think what the Ministry of Agriculture is doing about looking for sentinels in birds. And what we are trying to think with the Ministry of Environmental Protection, how to use mosquitoes in a smarter way, where we are trying to find it earlier when it meets people, not in the rural areas, but actually in cities. All of those attempts is in order to build a monitoring infrastructure different than what we had. It's not just the plasma donation, but it's one part of it that can be helpful as well. And we totally agree that people should do their job. It's very challenging, as I said. Okay, thank you.